So this is the front of our building, JFK Johnson Rehabilitation Institute. We are located in Edison, New Jersey, which is in central New Jersey. It's about a 45-minute ride from Manhattan or New York City, and also from Philadelphia, Pennsylvania, and about 45-minute drive from the Jersey Shore. We're also close to 2 or 3 major airports, major train stations, so there really is a great central location and a lot of access. So I told you I was the associate program director, and Dr. Sarah Cucurullo is our program director, also chair of our department and professor. We are the department of PM&R for 2 medical schools, Rutgers Robert Wood Johnson Medical School, as well as Hackensack Meridian School of Medicine. So you can see the decals at the bottom of the PowerPoint. Rutgers has been around for many, many years. They're actually undergoing a merger right now, so I believe they will be Rutgers Medical School, and we will still be the Department of PM&R for them, for the Robert Wood Johnson campus. And also Hackensack School of Medicine is a newer medical school, and we have medical students from both programs that rotate with us on mandatory rotations as well as elective opportunities. We are a rehab institute. We have 94 inpatient beds, and we are attached to an acute care hospital, JFK Medical Center. We also get many of our referrals from other trauma centers in the area, such as Hackensack University Medical Center and University Medical Center, as well as Robert Wood Johnson University Hospital in New Brunswick. So first, I wanted to talk a little bit about our academic curriculum. I know some of the other presentations, students had asked what are some of the strengths of our program, and I think our academic curriculum is one of the great strengths of our program. It's very structured, and it covers 12 major topics in the field of PM&R. The residents get protected block time each Tuesday morning from roughly 8 a.m. to 1 p.m. So this time allows them to focus on visiting lectures from professors, journal club, grand rounds, and a different topic is covered each month. Our didactics are also resident driven. So a resident class is assigned to a topic area and presenting the lectures for that time. The curriculum repeats 3 times during the duration of the residency program. So each year, the residents will cover all of the 12 major topics, but a different class will be responsible for presenting on that topic. So all of the residents not only get to learn in different ways from other presenters, but also get to learn by presenting the material themselves over the course of 3 years. We do have a lot of guest speakers from other universities and medical centers, and we have a lot of different workshops that are built into the curriculum, which I will talk about in a later slide. We also have a very unique senior board review course that's given the latter half of the PGY 4-year. It is a structured course that's usually about once a week, and it follows a structured curriculum and utilizes the PM&R board review book, which if you have not seen yet, you most likely will as you start your training. We are actually currently finished working on the upcoming 5th edition of the PM&R board review book that should be coming out in a couple of months, and we're very excited about that, but that is used also as part of this course. We provide mock exams for our graduating seniors for part 1, and we actually also invite back our graduated seniors the next year to do an oral mock exam before they take their part 2 exam. We also have an anatomy cadaver course that our PGY 4 residents participate in with the orthopedic surgery residents at Robert Wood Johnson. Our residents over the course of their PGY 3 and 4 year also go to a couple of outside courses. They go to Penn Medicine, Temple, and Moss Rehab to go to courses on gait and mobility, on prosthetics and orthotics, and also on electrodiagnostics. And all of those courses are covered by the department. In addition, we have workshops that are given within the department at JFK Johnson Rehab. Your PGY 2 year, you learn about how to manage patients who have trachs in a trach course at the very start of your PGY 2 year. Also, each year, one of our sports medicine fellowship trained attendings runs an ultrasound course. This actually occurs over the entire course of the year, and it's repeated twice, and it focuses on the anatomy and utilization of ultrasound of the shoulder, elbow, hand, and wrist, and the hip knee, ankle, and foot. And then there's also an OSCE at the end of the year. We also have a joint injection workshop where you learn a no-touch technique and how to do proper joint injections. And then we also have spasticity workshops as well. We also have research opportunities throughout the course of your residency training that residents can choose to get involved in. We also do annual quality improvement projects. All of our residents participate in those, and they actually present their work during an end-of-year presentation in front of some of our quality improvement faculty as well. Many of our residents have posters, abstracts, and talks accepted at the national conferences such as AAP and AAPM&R, and we're very excited to send many of our residents each year. So I talked a little bit about the academic curriculum. The next part is the clinical curriculum. We're very excited. We have 35, 40 attendings in our department that have a diverse interests within the specialty of PM&R. And we have 15 total residents, 5 residents per PGY 2, 3, and 4 year. And it allows us to have a one-to-one teaching ratio with each individual rotation that the residents are on. During your PGY 2 year, it's all inpatient, and the different services that you rotate on include brain injury in our traumatic brain injury unit, cardiopulmonary rehab, spinal cord injury rehab, Parkinson's and movement disorders, and stroke. During your PGY 3 year, you branch out of the inpatient and you go into their outpatient clinics, as well as go into the hospital and do consults. So your PGY 3 consult rotation is at JFK Medical Center, I'm sorry. You also do a rotation with electrodiagnostics and musculoskeletal medicine. We have 2 rotations that are kind of like triples. One is a rotation where you work with our interventional pain and sports medicine attendings, as well as our traumatic brain injury attendings on a sports medicine, pain management, and concussion rotation. And then our last rotation is where you spend a couple of weeks doing spinal cord injury medicine at another rehab hospital so that you can take care of patients on ventilators. You also spend a month doing pediatric rehab, and then you also spend time with an orthopedic surgeon, some time in the OR actually with them, and also some time doing joint injections in the clinic. And his volume is very large, so you get a lot of hands-on experience there as well. During your PGY 4 year, you do an additional 2.5 months on the EMG and MSK rotation, and residents have no trouble getting the 200 required EMGs before they graduate. You also have time spent in our dedicated prosthetics and orthotics clinic, where you see patients with both upper and lower limb amputations. You do trauma consults at Robert Wood Johnson University Hospital, which is a level 1 trauma center. And then you also work on our transition to care rotation, which is an opportunity to work in our aftercare and stroke recovery outpatient program, as well as do consults at a subacute or skilled nursing facility. Excuse me. And then I believe my next one, I'm going to jump ahead, is your elective. So during our senior year, we afford residents 2.5 months roughly of elective time. 1 month is allowed out of house, and 1.4 months is required in-house. Residents can use that to do clinical rotations, but they can also use that time to do dedicated research work as well. So just to circle back on our clinical curriculum one more time, we also, in addition to having that one-on-one experience on your rotations, have clinical competencies that are built into each rotation. And this is a specific program. Dr. Guerrillo published multiple papers on this topic, and it's another way to help ensure that residents are learning the material that they need to learn. Residents also get a lot of hands-on experience. They get over 200 EMGs. They have experience using ultrasound both in our spasticity clinic as well as our MSK and sports medicine clinics. They get many, many Botox and baclofen and pump injections and refill experience in our full-time spasticity clinic. They work with our prosthetist and orthotist, the P&O team. And throughout all these rotations, they also get a lot of joint injection experience. Residents also have the option to work in a optional sports medicine program. This is an opportunity for residents to volunteer to sign up and work sideline coverage for many different high school athletic games. And the department also provides financial compensation for this opportunity. At JFK Johnson Rehab, we have 2 one-year ACGME accredited fellowships, one in pain management and one in brain injury medicine. And we accept applicants both from our own program as well as from outside institutions. Just to give you a little highlight of some of the recent fellowships that our residents over the past couple of years have attained. Residents have really gone into all different types of specialties for fellowship, and we feel that that's just a great indicator that they get a great, broad, well-rounded training in our residency program, and that they're able to learn about a lot of different areas and pursue fellowships in many different areas. So for example, we've had people do brain injury fellowships at Mayo Clinic in Minnesota, Baylor, Peds Rehab at the University of Pittsburgh, pain medicine at our own institution, but also at Penn or Montefiore, and sports medicine at Montefiore and Geisinger. And also recently, kind of closer to my heart, some of our recent fellowships have also pursued cancer rehab fellowships at the University of Pennsylvania as well. Our graduates also have gone on to have careers both in private practice as well as in academic institutions. And they've been at universities all over the country. Also, private practice tends to focus on the sports, EMGs, and interventional pain, but also in traumatic brain injury and spinal cord injury as well. So this is my last slide. Wanted to thank you for your attention. If you do have any questions, this is the contact phone number and email of our residency program coordinator, Beth Bolger. I hope I gave you all an overview of our program and I didn't speak too quickly. And if anybody has any questions, we're happy to field those now. Otherwise, Dr. Patel and Dr. Ferber are also available to answer questions or to tell you a little bit about what they love about the program.
So the first question is about the call schedule. Call kind of decreases throughout the 3 years, but we do take home call. As a PGY2, you work 6 weekends. So starting Friday at 5 p.m. until Monday 8 a.m., you're on call. And you're responsible for admissions and rounding on the floor is Saturday and Sunday during the day. And you're on call with an attending over the weekend. And then usually as a PGY2, you have 20-something weekday calls. As a 3, you have 4 weekends and maybe 16 to 17 weekdays. And then as a PGY4, you have 1 weekend and 6 weekdays. Yeah, so I think before it kind of used to be kind of split evenly, but since we've been here, it's kind of been kind of like tapered down through the years.
This is a 5-minute warning.
Next question, Dr. Ferber, do you want to try this one? Are a majority of your residents New Jersey locals?
I would say Northeast. I'm from New York. We have another New Yorker. We have Pennsylvania. We have, I think Virginia is where one of the PGY2s is from. One's from Missouri. So we get people from all over, but I think the Northeast in general is just a hot spot for PM&R. So we do have a lot of Northeast local residents.
Next question, wondering what the program does to support resident wellness. So I will let our chiefs talk about that. But in general, yes, we do have a wellness program. We use some of our protected didactic time for wellness activities. Some things are built into orientation, your PGY2 year, but the department also sponsors our residents to do wellness activities themselves outside of training and clinical hours. So if you guys want to add anything to that.
Yeah, the wellness events are actually one of my favorite parts of the program. So we have 5 blocks a year, and each block there's a different event. So we're actually going to go rock climbing next month, but we've done like art classes, hiking, apple picking, go-kart racing. So
Okay, next question is, could you describe any opportunities for residents to become involved in medical education? So one aspect is our residents actually do a lot of teaching just amongst themselves, number one, as part of the resident-led didactics that are done every month. So they're actually teaching their colleagues the material necessary for the topic covered, so stroke or spinal cord injury or whatever. And we do have an attending who is present and reviews the material with the resident class before the didactic month to make sure that the important topics are covered. We also, like I mentioned, are the Department of PM&R for 2 medical schools. So we have a lot of medical students rotating with us, and we try to keep that 1-to-1 ratio with the student to the resident as well. So the residents do have a lot of opportunities to work and teach medical students. We also do very much value our residents' feedback, especially students who come and rotate with us on electives and then potentially apply with us. And our residents are really part of our interview process as well and help us to learn about, students from rotations and experiences.
And this is a 2-minute warning?
So this is not related to the program, but are there good places to go apple picking in New Jersey? From a Bergen County native. I mean, I think New Jersey's got a lot of farms around, so I don't know that there's a bad place to go picking, but yeah, I don't have a particular one in mind.
we went to Morristown. I forgot the name of the orchard we went to, but that was great.
See, we have another minute or two if Dr. Ferber or Dr. Patel want to add anything else.
So I actually learned about JFK through PM&R Scholars too, and I wrote to there as a med student. I think the thing that drew me into the program was the people. Everyone was very welcoming. The attendings and the administration were very supportive of like not only the residents, but like the med students. And that's what kind of drew me in to this program.
I would say one of the things that drew me kind of answers actually this last question. But I visited JFK back in the day. They did a different kind of medical students day, and talking to all the attendings and getting a gist for the program, they were really invested in the residents and cared about them from a personal standpoint, but also a career development standpoint. And they just are always looking for residents to get involved in extracurricular projects or activities to help them advance and get ultimately where they want to be, whether that's fellowship or job. And going through the last 3 years, I've felt so supported and from day one on, what do I want to do and where do I want to go? And, just very well supported.
You're right, that feeds into the last question well.
And yes, definitely cross-class mentorship because I still text my chief to this day because he went into brain injury and I ask him many, many questions. So yes, lots of cross-class mentorship as well.
We do have a buddy program actually, so a resident from each class is kind of assigned to a family that provides kind of a formal-ish mentorship, but our program still retains that family feel. So like Dr. Ferber was saying, all the attendings are really have open doors and willing to talk with and help our residents in any way that we can.
Thank you so much for your presentation. Very enlightening.